Hello, I'm Connie, and currently I'm a stage 4 breast cancer patient. When I was first diagnosed, I was a stage 3 cancer patient, and I was diagnosed in Korea. So I received my chemotherapy, radiotherapy, and surgery all in Korea during COVID. Initially, I first felt numbness, tingling sensation, and also feeling like my arm was always bloated. I first felt this feeling about 4 months after my surgery, and I immediately went to my oncologist and mentioned it to him during my treatment. He very quickly, promptly referred me to the physiotherapist. After a few weeks, I saw the physiotherapist, who, upon looking at my arm and hearing about the feelings of bloatedness, numbness, and tingling sensation, very quickly diagnosed me with lymphedema because I had removed all my lymph nodes during the surgery. And he then taught me how to do the massage and how to bandage my arm, and also prescribed compression garments for me. So it was caught at a very early stage. Back then, I was probably a stage 0 or 1 for lymphedema. After following the massages for a while, the swelling subsided, and from then till now, it's always been under control, meaning whenever I feel like this feeling is coming back, it's bloating up, it's swelling up, I would wear the compression garments, I would do the massage more diligently, and then it would return to its original size, and I would be okay again. So I'm very sensitive to the flare-ups now, and because of that, I think my arms still look pretty much the same size. Lymphedema, even though I'm a stage 0 or 1, it definitely has affected my day-to-day life. I am unable to open bottles, so I cannot unscrew a Coke bottle, and I always have to rely on strangers' help to open just a mineral bottle. And being a young mom, from the start, after I had lymphedema, I was also told that I cannot carry my toddler, who's heavier than a bag of rice. And currently, I'm also trying very hard to strengthen my muscles so that I can carry him. Basically, I've learned that you cannot do it immediately. You kind of have to strengthen your muscles, gradually do it as part of like a process. So immediately after the surgery, the lymphedema actually worsened because I tried to carry my baby then, who was about 8 or 9 kilograms. After that, I actually had to stop carrying my baby and then strengthen my muscles and gradually increase the weight until I could reach his weight and carry him. Currently, he's about 17, so I still have a long way to go. He's growing too fast. I was very fortunate to have been in Korea at the time of the lymphedema diagnosis because I was caught early, referred to a physiotherapist very promptly, who took my cares and concerns very seriously and actually prescribed a whole range of treatment options for me, even though my arms weren't really big then, and it was just a feeling of tightness, bloatedness, and tingling sensation. I've heard of stories in Singapore where it was difficult for my friends to get diagnosed, and unfortunately, because they were diagnosed at a later stage, their arms are much bigger, and it's quite tough, or it might be even impossible for them to fully reverse the effects of it. Also in Korea, my garments were actually sponsored, and bulk of it could also be, they were heavily subsidized, and I could also claim from insurance. So I have so many garments which came at almost no cost to me. That was why I could also receive the complete treatment without fear of, heavy treatment fees. And I think that that's something that should be available in Singapore, especially when there are so many suffering from the effects of lymphedema.
Hi, my name is Ting. I got diagnosed with breast cancer last year. I'm 35 this year. And I did the trifecta of cancer treatment: surgery, chemotherapy, and radiotherapy. I've heard of this thing called lymphedema. I was told that there's a chance that I'll get lymphedema, but I wasn't given more information. I didn't know what lymphedema was. It was just this, your hand might swell. If it swells, let us know. So I was like, okay. And then I did treatment. And one day I was wearing this shirt and it was really tight in my arm. And I thought, am I gaining weight? Am I gaining weight during treatment? So when I got diagnosed last year, I was living in Australia. So I did my treatment in Australia. After my surgery, I was told that because I have lymph nodes removed, I have a chance of getting lymphedema. But I wasn't told much about it. They just say if you feel something wrong or if you feel like your arm swelling, just let them know. So one day, about 4 months in after surgery, when I was doing chemotherapy, I was wearing a shirt and it felt a bit tight. And I thought I was gaining weight. So I went to my breast care nurse in Australia and she got me to stand on this machine called a Sozo machine to test, I suppose to test the amount of fluid in your body. And the numbers did go up. So she confirmed that I have lymphedema and she referred me to a lymphedema physiotherapist. She gave me instructions to do lymphatic exercises to try to manually move the lymph fluid to the more active lymph nodes on the other side of the body. And because I'm not a lymphedema expert, I don't know anything about lymphedema. I don't even know what I'm doing with these exercises, right? I don't even know if it's working or not. So I was just doing what I was told, but I don't know what I was doing. That was my experience in Australia. They just say, okay, just wear the compression garment, and there's a possibility of a surgery called an LVA that they might want me to do. I suppose getting lymphedema is not the end of the world. However, there are things that you need to do to manage yourself. Like there's only so much that a physiotherapist can do. So there's steps that you can do at home. Educate yourself, know more about this condition. You can ice yourself on affected areas. Like just the other day, I went exercising and I got home and I felt my hand was really swelling a lot. So I iced it and, try to massage it, even though I don't really know if I'm doing the right thing. The good old saying, one day at a time. I think at the start, you might think it's a cliche, but you will slowly realize that just take things one step at a time. It's not the end of the world if you get lymphedema. It's just one of the many side effects of cancer treatment, and yeah, just take it as it goes.
So my name is Lai Har, and I had stage 3 breast cancer about 4 years ago. I'm now in remission, and I also have lymphedema naturally. No, not naturally, but I have lymphedema as a result of the radiation actually that triggered it. So on the 3rd day of my radiation treatment, I was told that I had some swelling. So I consulted the radiation oncologist. She was very nonchalant about it. She said, no, my focus is on the radiation completion. So she's the expert, right? So I was also quite chill about it. And we just focused on the 15 days of radiation. And then at the end of it, it was actually I, ironically, who asked about getting a compression garment. And I was referred to the lymphedema therapist. To cut a long story short, I think my arm was kind of, the condition was worsened as a result of poor treatment. So yeah, I would say initially when I heard about it, I was very dismissive. I relied on expert opinion, on hindsight, erroneously, to my detriment. I think it's your next question that I would answer about how I then feel when I did get it. Yeah. Yeah, so I have a very active lifestyle in terms of traveling and trekking and, doing lots of things. So I was all ready when my treatment ended to resume. The swelling wasn't that particularly severe at the beginning. So I asked to say, hey, I hear that garments are the treatment, standard treatment. So I actually initiated and went and got one from the physiotherapist. It wasn't customized and there wasn't attention paid to it. So as a result, when I wore the standard garment, it actually exaggerated and my condition got worse. And thereafter, it was kind of a living hell because my quality of life was completely taken away. Partly because the therapists themselves were quite ignorant. They told me I couldn't do yoga, I mustn't do this and that. And I was like, what are you talking about? You know, I survived cancer to have my life taken away from me. You must be kidding, right? But I think it moved me to desperation because I then realized that people don't know about lymphedema sufficiently, not even the doctors and the therapist. They knew what they knew, which was very limited. And so my journey of discovery is really, you got to take control yourself, because I relied on them and then I found that they were not reliable. I lost control and I was very upset, depressed even actually, because you know, I couldn't resume all the stuff and I didn't have confidence they knew what they were talking about. So I was quite desperate. I was going to go to extreme measures like doing LVA and the lymph node transplant, until miraculously or divine intervention led me to Veron. And the first thing I remembered always that Veron said to me was, you can claim your life back. You don't have to surrender it. I've got patients that run marathons, etc. So she recounted her personal story, which was very moving. How she walked the El Camino crying like a little Asian girl. And I was like, my gosh, this is a very brave woman. And I'm surely I can do it too. So my path of recovery was due to the confidence that Veron gave me. Secondly, she knew what she was doing, unlike the rest. Thirdly, she had the passion to be interested and customize treatment to you. And I think that all that is very important to give me anyway personally, because I'm the type that really do like to know that I'm in the good hands of people who know what they're doing and not bullshitting me, right? So Veron knew what she was doing. So I think she restored my hand within a month. And then thereafter, I've been delinquent. I mean, I negotiate with her where I said, look, I'm not prepared to do too much things with the treatment, because she bandages me up quite badly, you know. I mean, I look like a walking wounded, right? But it was necessary. But I mean, to me, it wasn't so sustainable if I continued. So I decided that I will do my own, what I call my 3Ms, right? Monitor, manage, and modify my activities. So every time something flares up, I send a picture to Veron and SOS her. Then she reassures me that I'm okay. So yeah, that's how I'm handling it in terms of my journey. So for me, the first lesson really was take back control and accountability. I mean, I thought the doctors knew best. They don't. Actually, they don't, because I don't know, I subsequently found out that they don't actually learn a lot about this, and it's treated as a secondary condition, a fringe condition, outsourced to physiotherapists. And I think in the scheme of things, cancer, rightly or wrongly, is more key. So I think as a patient, I think the medical system needs to highlight to the patient and alert them, and the patient needs to take accountability to learn about it. Secondly is, you know, I didn't get the access that people now can, thanks to, again, Veron's initiative with the Lymphatics Support Group for mental health and also for guidance in making informed decision. It is vital that, you know, people who are diagnosed with it actually can approach others like us who have gone through like the good, the bad, and the ugly, to reassure them that they're not the only one. In the end, everyone has their own treatment. Like some wants to, you know, be really careful. Others, like me, is like, okay, like I can manage and still live my life, right? So I think each experience is valuable. So reaching out, and I'm so glad that the Lymphatics Support Group exists, because cancer has a lot of support group, not lymphatics. And, you know, you'll be amazed how many people are reassured to know that it is not a condition that they cannot take back control. But you must also accept, like I had to accept, that there is a new normal in my life, which anyway, when you grow old, it'll hit you anyhow. But with lymphatics, your new normal is that you actually do have to modify, and then live and let live with the fact that you're grateful that you can still sort of continue. So I would say, yeah, take control, don't rely on people. Make sure you have a very good therapist that you have confidence in and has confidence in you as well to do the necessary. Some are naughty, some are not. So, so I think these are the two key things I would say.